morning. Happy Wednesday. Hope you all have had a good week so far. And I've got a bit of seemingly good news from the right side of things today. We're covering a story that the left either isn't really covering or doesn't want to cover or thinks is nothing. It's part of this program on Ground News called Blind Spot, where you can see the stuff that the left isn't covering and stuff that the right isn't covering, and it kind of gives you a like a big picture of like who isn't covering what and why. And if you really want to get into it, you can go even more in detail with that kind of stuff, but that's not today's story. No, today's story is from Reuters, which, if I look up Reuters, did I spelled it right? Yep. Reuters has a center overall bias rating from all three companies that do the ratings, as well as a high factuality rating from three companies. It is owned by Thomson Reuters, as well as the private equity Woodbridge Company. Musk's Neuralink gets FDA's breakthrough device tag for blind sight implant. This is by Reuters, and it was released today. September 17th, Reuters, Elon Musk's brain chip startup Neuralink said on Tuesday its experimental implant aimed at restoring vision received the U.S. Food and Drug Administration's breakthrough device designation. The FDI breakthrough tag is given to certain medical devices that provide treatment or diagnosis of life-threatening conditions. It is aimed at speeding up development and review of devices currently under development. Now, there's more to it than that, and we'll get into that in a second. The experimental device, known as Blind Sight, will enable even those who have lost both eyes and their optic nerve to see, Musk said in post on X. We'll see. Neuralink did not immediately respond to a request seeking details about when it expects the Blind Sight device to move into human trials. The FDA also did not immediately respond to a request for comment. Well, yeah, it just happened. I don't think they would be ready to comment yet. Founded in 2016 by Musk and a group of engineers, Neuralink is building a brain chip interface that can be implanted within the skull, which it says could eventually help disabled patients to move and communicate again and also restore vision. Neuralink's device has a chip that processes and transmits neural signals that could be transmitted into a device like a computer or a phone. The startup is separately testing an implant designed to give paralyzed patients the ability to use digital devices by thinking alone, a prospect that could help people with spinal cord injuries. The trial is expected to enroll 3 patients to evaluate its device in a study expected to take several years to complete, according to details on the U.S. government's clinical trial database. And then that's the end of this article. Pretty short little article, just like an update on the Neuralink thing. Coming over here to FDA.gov, what is the Breakthrough Device Program? The Breakthrough Device Program is a voluntary program for certain medical devices and device-led combination products that provide for more effective treatment or diagnosis of life-threatening or irreversibly debilitating diseases or conditions. The Breakthrough Devices Program is intended to provide patients and healthcare providers with timely access to medical devices by speeding up development assessment and review for pre-market approval, 510(k) clearance, and de novo marketing authorization. Breakthrough devices must meet the FDA's rigorous standards for device safety and effectiveness in order to be authorized for marketing. The Breakthrough Devices Program reflects our commitment to device innovation and protecting the public health. The Breakthrough Devices Program replaces the Expedited Access Pathway and Priority Review for medical devices. The FDA considers devices granted designation under the Expedited Access Pathway to be part of the Breakthrough Devices Program. Now, there's a whole lot more on this particular page. If you go to fda.gov and look for the Medical Devices Program, you can look into that more for yourself. The other thing I wanted to look at was this Neuralink, the actual program. Redefining the boundaries of human capabilities requires pioneers. Neuralink is currently seeking people with quadriplegia to participate in a groundbreaking investigational medical device clinical trial for our brain-computer interface. If you have quadriplegia and want to explore new ways of controlling your computer, please consider joining our patient registry. And then, of course, they have a mission statement: create a generalized brain interface to restore autonomy to those with unmet medical needs today and unlock human potential tomorrow. Brain-computer interfaces have the potential to change lives for the better. We want to bring this technology from the lab to people's homes. Okay. So, a lot of this stuff, I always, like, really try not to get excited about it because a lot of it ends up being, like, tech bro hype. But if this made it past FDA scrutiny, there is a chance that this isn't just like, smoke, right? And if it's not just smoke, this could be great. I mean, solving people's blindness, helping people with quadriplegia, like, I had a friend growing up who was basically nearly quadriplegic, and if he had been born maybe 10 years later and was still alive, like, this would have helped him. It's always crazy when I cover stories like this because it's like, man, I feel like I'm a man from the future, but I'm a man from the past, like we're talking about like cyberpunk stuff, right? We're talking about getting like mods, like getting modded. It's crazy. The world we live in. Anyway, whether you take this as good news or just tech bro hype, that's up to you. I'm personally just gonna go with good news and then be proven wrong later, maybe. We'll see. This has been Let's Talk About Us. You all have a lovely rest of your Wednesday, and I hope to see you tomorrow.